Welcome to E Squared Emporium for all things AP Psychology. Today we will be looking at psychopharmacology, which is the science of the effects of psychoactive drugs. So psychoactive drugs refer to a chemical substance that alters perceptions and moods and causes changes in behavior and cognition by modifying our conscious awareness. There are three major types of drugs: depressants, which include narcotics and opioids, stimulants, and psychedelic hallucinogens. We're going to talk about addiction. Addiction is a compulsive drug craving and use, even though you know there's going to be adverse consequences. You could lose custody of your children, it could be divorce, you could lose your job, and yet you are chained to it and must continue to do it. Tolerance refers to larger and larger doses of the drug to get the same effect, particularly drugs like cocaine, where you need to keep taking more and more to feel the same high. Withdrawal refers to the discomfort and the distress once you go into rehab, or once you try to stop using the drug. They are unpleasant and even painful. As the neuron is reshaping and changing, it's actually quite a painful physical reaction. So there's physical dependence, which is what the body does. The body becomes biochemically dependent on the drugs, and some of those withdrawal symptoms are quite painful. And then there's psychological dependence, where you actually crave the drug, even though it's no longer biologically needed by the body. So drugs are either an agonist or an antagonist. So our exciter neurotransmitters are going to be the receptor sites where an agonist is going to sit. So it's a drug or a chemical that will activate the same receptor sites. Remember, that was the gas pedal, the exciter neurotransmitter. The antagonist, think of an antagonist in your English stories. An antagonist is often the bad guy. So this is the drug that's going to inhibit or block. So the neurotransmitter can't get to the receptor site because the antagonist is sitting there blocking it. A reuptake inhibitor is a class of drugs, most of them are prescription, that actually treat depression, and they treat many other conditions. Typically they're stimulants. They are going to prevent the reuptake of the neurotransmitters in the brain. So they inhibit and prevent reuptake. So one of the ones we're really going to talk about are selective serotonin reuptake inhibitors, known as SSRIs. So again, an SSRI, you might have heard of Zoloft or Prozac. They, by blocking and inhibiting, they increase serotonin levels. They can also increase the levels of norepinephrine and dopamine, and they can create a level of euphoria in the body. We typically use them for depression. They also help with anxiety, social anxiety, panic disorder, OCD, obsessive compulsive disorder, many eating disorders, PTSD, which is post-traumatic stress disorder, and depersonalization disorders. So next we're going to fill out the chart, and that's going to be on the next video.